Okay, so now we will be looking at syndrome. Goodpasture syndrome is type 2 hypersensitivity disease in male dominant caused by anti-basement antibodies. When anti-basement antibodies attack the collagen glomerular and pulmonary capillaries, then Goodpasture syndrome develops. And in this, hemoptysis occurs, dyspnea, and possible respiratory tract infections with no upper respiratory tract involvement like sinusitis, no skin involvement, and no GIT involvement occurs is in vagus glomerulonephritis. All these three things occur. So, Goodpasture syndrome has diagnosis of anti-GB basement antibody, kidney biopsy is accurate, anemia is often present, and chest X-ray shows pulmonary infiltrates. Treatment will be plasma exchange, immunosuppressive therapy, glucocorticoids, and renal transplantation. So in this way, Goodpasture syndrome can be treated. Okay, so now we will be looking at venous granulomatosis. It is necrotizing, medium-sized, small vessel vasculitis. Males are more prone to develop this, and it occurs in age of 40 to 60. Markers of the disease are elevated serum C and K protein, upper respiratory tract infection like sinusitis, otitis media, rhinitis, nasal mucosal ulceration, and saddle nose appearance. Lower respiratory tract infection includes pulmonary infiltrates, hemoptysis, nodular regions, and renal involvement like hematuria, red cell involvement, red cell cast, and microscopy. Now, the diagnosis is presence of C and K focal necrotizing glomerulonephritis, crescent glomerulonephritis is present. Another disease is Alport syndrome. It is hereditary glomerulonephritis because of progressive chronic renal failure, X-linked disorder, and it is caused by defect in glomerular basement membrane synthesis because of collagen type 4 abnormality. Clinical features will be microscopic hematuria, onset in symptoms, age is overt renal function, renal failure, family history, nerve deafness, eye disorder like lens dislocation, posterior cataract, and corneal dystrophy. These are the triad of this disease, Alport syndrome. And renal biopsy shows electron microscopy, basket weave appearance, anti-GB thickening, alternating with areas. So in this way, we can look at the Alport syndrome.